We're following several new developments on the pandemic, including the potential of a vaccine for younger kids. We are joined live by Dr. Jeff Pothof from UW Health. And Dr. Pothof, you're really the person we need to talk to about this. What about the vaccine? We're hearing it could be ready by Halloween. Are we on track for that?
I'm hearing the same thing. It sounds like Pfizer is getting ready to submit their data to the FDA pretty soon. Now, that could happen in the next couple of weeks. Typically, then the FDA would spend about a week reviewing that data. If they think it looks good, the committee, the AICP, would then look at that data on behalf of the CDC. An update would be published in Morbidity and Mortality Weekly, which then would instruct clinicians on how to do that vaccination process. So I think all of us parents who have kids in schools would love to see this vaccine available sooner than later.
Absolutely. And what about this latest FDA warning? I read it over the weekend for parents to really stress to wait till the vaccine for kids is officially available. I mean, are parents going and trying to get the vaccine that's available right now for older populations and give it to kids?
We do hear cases of that, and I think those parents are well intentioned. I think, there's a lot of fear and anxiety about our unvaccinated kids with pediatric cases so high right now that they just want to get that dose in. Unfortunately, it does look like that Pfizer dose for those younger kids is going to be a different dose. So we need to be careful that we aren't jumping the gun and trying to get our kids vaccinated with a dose that probably isn't optimal for them. And just wait a few more long weeks, I guess, although maybe it's just a few weeks, for that dose to be settled on and these vaccines to be available for our kids. Don't try to jump the gun.
Okay, and now I know our 2-week average has been trending downward lately, like that's a more recent thing. But tell me, is that a sign in the right direction, or are we still, are doctors still kind of alarmed at the increase of cases? What are we seeing? Because I also know hospitalizations are up.
Yeah, I think this is a fingers crossed moment. We've seen things level off just a little bit, start to decrease, and we hope that we're on the downward slope of this Delta peak. Other times in the recent history, sometimes it's just a brief leveling off before things go back up again. But we sure would like to see this Delta peak start to slow down sometime here in the near future. That would be good for all of us, both healthcare systems, hospitals, but as well as folks in our community who've, had a hard time of it during summer going into early fall with all these COVID cases.
All right. And finally, last question, we want to touch on the vaccine and pregnancy. The CDC saying pregnant women who are breastfeeding should not hesitate to get the vaccine, that it's a better option for them. What is your message to them? Because we know pregnancy, being a new mother, that brings itself a lot of anxiety, and you never want to do anything to put your kid at risk.
Yeah, this is a great question. We know a lot about the vaccine and pregnancy. And if you look at the American College of Gynecology experts in this field, the Maternal Fetal Medicine Society, they are all recommending that pregnant women get vaccinated, even more so than regular people, because we know that folks who are pregnant, who come down with COVID, they do worse than even people who aren't pregnant. So if you're pregnant, if you're breastfeeding, the recommendation 100% right now is to get vaccinated. There's really no reason you wouldn't want to do that. The benefits far exceed the risks in your situation.
Yeah, that's definitely a good reminder, good warning. Thank you so much for your time with us. We always enjoy when you get to answer our questions on Tuesdays. And a reminder, we do have expanded coverage on the pandemic, including information about how to get vaccinated or find a testing site at tmj4.com/coronavirus.